Hi, it's me again. Saturday afternoon, time for another educational video. So today I want to talk to you about the Senate healthcare bill, and specifically I want to talk to you about the portion of the bill that proposes to defund Planned Parenthood. And we can't have this conversation without addressing the elephant in the room, which is that Planned Parenthood, among all the other services that it provides, also provides abortions. It's not the bulk of what it does. The bulk of what it does is provide mammograms, pap smears, treatment and screening for sexually transmitted infections, birth control, prenatal care, and yes, abortion services. And the people that they provide these services to, by and large, are people that are poor or low income. And I say people because it's not just women that they take care of, it's also men. So it's not a women's issue, it's an everybody issue. But your senators who are trying to push this healthcare bill through that defunds Planned Parenthood and slashes Medicaid spending also know that a lot of their constituents feel like, I don't want my tax dollars to pay for somebody's abortion. Want to know a secret? They don't. They don't, and they haven't since 1980, but we'll talk about that in a minute. There are also an awful lot of people in that constituency who feel like they don't want to pay for somebody else's health care. We talked about that in episode 2. And again, we're going to have to pick which pocket we want to pay out of, because we're all going to pay one way or another. What you need to understand about the funding for Planned Parenthood is that it's not a line item on the federal budget. There's not a line that says, here we pay this amount of money for defense spending and we pay this amount of money for Planned Parenthood, and they send the money off. They don't just write a blank check for gazillions of dollars signed by, that's supposed to be Trump, but no way he'd sign that. And it's just for whatever. Here, Planned Parenthood, here's the money, spend it however you want to. That's not how it works. The way it works is more like if you consider Medicaid to be an insurance company and Planned Parenthood is the doctor's office. And so you have a woman who's low income and she goes to her Planned Parenthood office and she gets a pap smear. And then Planned Parenthood sends an invoice to the federal government via Medicaid and says, hey, we need payment for $20 for that pap smear. And then Medicaid reimburses Planned Parenthood for that pap smear, for a portion of that pap smear. Now, if that same low-income lady went into Planned Parenthood and had an abortion, first of all, Planned Parenthood would not send a bill to the federal government, and even if they did, it would be denied. The reason it's denied is because of a little law called the Hyde Amendment. And the Hyde Amendment was a law that was passed in 1976 that was affirmed by the Supreme Court in 1980. And basically what it does is it excludes abortion from the comprehensive services that are provided by Medicaid. In other words, what it does is it prevents taxpayer dollars from paying for abortions. Okay? You want to know the best way to prevent abortion? Birth control. Invest in family planning and you will prevent unintended pregnancies, and then you will prevent abortion. It's really easy. So here's how it's going to work. If they defund Planned Parenthood, what's going to happen is the low-income lady is going to go trotting down to her Planned Parenthood office, and it might say, we're closed, we're out of business. Or they might just say, nope, we don't accept Medicaid payments anymore. So it would be like you going to your doctor with your Blue Cross card and your doctor all of a sudden saying, I don't accept Blue Cross anymore. It's the same thing. They're basically, the federal government is breaking their contract as the insurance company with the doctor, Planned Parenthood, and saying, we're not doing business with you anymore. And that's how they're going to put Planned Parenthood out of business. So what happens to that low-income lady when she goes to her closed Planned Parenthood clinic and she can't get her birth control because there's no other clinic in town that accepts Medicaid? She looks like this. She gets pregnant. And we know from years and years of study that if you have a person who gets pregnant without health insurance at the time that they're pregnant, and especially if they're low income, then they are at risk for no prenatal care or very late prenatal care, both of which put her at risk for having a preterm infant or a low birth weight infant. And those infants have extraordinarily high risks of incurring complications that cost a lot of money. They're at higher risk for cerebral palsy, developmental delays, learning disabilities, vision loss, hearing loss, lots of things that consume a lot of resources. And in fact, the Guttmacher Institute in 2005 did a study, and calculated the total societal cost of preterm deliveries of babies, and it's about $26 billion. That was in 2005. I'm pretty sure the cost has gone up since then. And if you break it down, a portion of that goes to the baby's medical care. That's about $17 billion. And these are annual expenditures, not over 10 years. This is every year. Premature births cost about $17 billion worth of taxpayer money and about $2 billion of maternal care. And there are other long-term expenditures as well, like these children, since they need assistive technology or one-on-one aids or special education, they consume other resources like early intervention costs $600 million every year. Special education services, about $1 billion a year. So these are very expensive pregnancies that we failed to prevent. Now, the senators will tell you, if we close Planned Parenthood, those ladies will just go to another clinic. Well, they will if there's another clinic in their city, but if they're poor and they don't have very many resources, they probably can't afford to get on the bus and drive 200 miles to get their birth control pill every month. So you're effectively cutting off their only means of receiving affordable birth control. So let's see what happened actually in Texas when they closed the Planned Parenthood clinics. So in Texas, the great state of Texas, just a few years back, there were only 23 counties out of the 254 counties in Texas that even had Planned Parenthood clinics in their county. But interestingly enough, those Planned Parenthood clinics provided 60% of the health care to poor and low-income women. So Planned Parenthood was doing the lion's share of the work when it came to reproductive health care for low-income women. But the Texas legislature did not like the fact that they could not withhold federal funding from these clinics just because they provided abortions. They wanted to put Planned Parenthood out of business. They wanted to not have to pay them any money. So what they did was they scrapped Medicaid and they instead created the Texas Women's Health Program, which I can barely say with a straight face because it doesn't have anything to do with providing health care and has everything to do with restricting abortion. So what happened in those counties when they took away the Planned Parenthood clinics? Well, they saw a sharp decrease in the delivery of IUDs, implantable devices, and Depo-Provera shots, which doesn't mean that there wasn't a demand for it. It just means that people couldn't get it, right? So 36% reduction in the use of highly effective dependable birth control. And at the same time, there was a sharp spike in unintended pregnancies. The birth rate spiked 27%. But these effects were only seen in the counties where Planned Parenthood had been in existence and was driven out of business. So the short-term, very short-term, like within the first year, effect of defunding Planned Parenthood was that you had an awful lot of unintended pregnancies. Now, I'm not here to advocate morality or to be a proponent or an opponent of abortion. I'm just here to talk about the efficient and wise use of our tax dollars. And by defunding Planned Parenthood, the federal government is essentially cutting off its nose to spite its face. Because what we do is when we defund Planned Parenthood, we take away reliable birth control services to the women who need it most, the poor women who can't even afford to have a baby and take care of that baby. So when we defund Planned Parenthood, we don't prevent abortions from happening. What we do is we increase the number of unintended pregnancies. Now, granted, some of those women will still get abortions. They'll get them somewhere else, not from Planned Parenthood, but some of them will keep those babies. But what will happen to us is that we will pay more money to support those women and their children, because if she couldn't afford health care, she probably also is struggling to make ends meet. So she's likely to utilize our tax dollars through food stamps, through WIC payments, through cash assistance to families with dependent children. So we're going to pay one way or the other. Personally, I would rather continue to fund Planned Parenthood, provide reliable health care to these women when they're trying to make responsible decisions, and not worry about the people who come to Planned Parenthood for abortions, because your tax dollars aren't paying for them anyway. But you are incurring a big loss to your tax bill. It's going to take a hit if you defund Planned Parenthood. So call your senators. Tell them not to defund Planned Parenthood.